It's really a dangerous problem, isn't it, Dr. Inouye?
Yes. And that's really, I think, a very important message about delirium and why I got so interested in it, because delirium often signals underlying, acute or severe illness that needs to be evaluated. And delirium itself can lead to complications like aspiration pneumonia. This is a pneumonia where people swallow their own secretions and can develop a pneumonia because they can't protect their airway because they're so sedated. It also can lead to complications of immobility and is associated itself with high rates of complications and even sometimes death. And so it's something we want to recognize early, we want to evaluate, we want to treat. And the other thing is delirium can be preventable. And so that's another reason why it's very important. And medications can contribute to delirium, and we can often switch around or adjust those medications. The other thing, if your loved one's just been in the hospital, so this now I'm moving to what family members can do in the home to prevent delirium. So they include things like daily exercise, making sure your loved one gets exercise, making sure that they eat right, that they get plenty of fluids during the day. And what I mean by eating right is eating enough food and eating healthy food, avoiding smoking and alcohol, making sure they wear their glasses and hearing aids so they can see and hear, making sure they get adequate sleep, ideally without sleeping medications is really best, and providing them socialization and activities that they enjoy. The other thing is to be aware as a family member of the medications that your loved one is on and their side effects, because many medications can have confusion as a side effect, and even medications we can buy at the drugstore without a prescription. And my patients were very surprised to learn you can go into a drugstore and purchase one of the most powerful antihistamines that we have, known as Benadryl or diphenhydramine. It's available without a prescription, and it is highly associated with delirium. So that's Benadryl or diphenhydramine, and it's in many allergy formulations and almost any medication that has sleep after it, like Tylenol sleep, Advil sleep. You see these sleep remedy sleepies.
Dr. Inouye, I wanted to ask a question that I get asked a lot because, delirium is one of the big Ds, right, for the geriatrics consult. Another big D is drugs that we talked about. But as I explained to families about delirium, the kinds of questions that come up are like, does this mean that they'll eventually develop dementia? Will it get better? How long will it take? And can you just comment about that a little bit?
I get asked this all the time, and this is what families obviously too really worry about. So, delirium is, in many studies, there is a heightened risk for dementia following a delirium. It's about a 4 to 5-fold increased risk following a delirium. But I'm going to add why I think that is. But not everyone who develops delirium will develop dementia. That's so true. We don't know the exact percentage because it depends on so many things. It depends on, how old the person is, what other illnesses they have, what other medications they're on, how severe was the delirium, what was the delirium caused by, how long did it last, So there's so many variables to the equation that it's almost impossible in one person to predict. But I have seen thousands of cases myself with a delirium that was very transient. So that's what I want to give reassurance. But on the other hand, a certain percentage I don't know if it's 20 or 40% will go on to develop dementia. And that can be because the delirium itself shows that that person had a vulnerable brain. And so a heightened risk to go on to dementia.
And there's also this concept of chronic delirium. And part of it is that people who get psychoactive medicines inside the hospital, even though it's outside the bloodstream now, it actually stays in the fat tissues a long time. And it just takes a long time to leach some of these things out of the system.
That's correct. Delirium can last a very long time in older adults. It's not unusual to see 3 to 6 months or even up to 9 to 12 months. I've seen patients with, major cardiac surgery who had a severe delirium that took up to a year to completely clear. And we're seeing that now too with COVID-19 and older adults being on ventilators in the ICU, getting terrible delirium, and it can take months and months to recover completely.